So we will select the test patient, we'll choose the top one, and you can double click or click and select OK. And this has pulled up a high-risk suicide flag, which you're welcome to read. If you scroll down, there's more information. We'll say close. There's an additional flag for this patient, or a number of additional flags since it's a test patient. Again, we can read through these, select close, and we'll walk through the general layout of CPRS. So it will open to the cover sheet, or if you have another chart open to a certain tab, it will open directly to that tab on the next patient. On the cover sheet, we have active problems, allergies, postings, active medications, clinical reminders, women's health, recent immunizations, vitals, and appointments. Across the bottom, we have our chart tabs. This is made to replicate a paper chart. So these are fairly self-explanatory: cover sheet, problem list, medications, orders, notes tab, consults, surgery with surgical notes, discharge summaries, lab results, and a variety of different reports. We'll go over each of these in detail on separate videos. At the top, we have our patient information bar. So this name tells their social security number, also used as the medical record number in CPRS or in the VA system, along with their birthday. If you click their name, it will open their face sheet, and this includes pertinent information such as their address, any temporary addresses. Toward the bottom in our system, we have their service connection status, which is relevant to their medical care coverage. This patient is not. You see that this has humanitarian emergency or humanitarian, which means this is a patient that is not enrolled in VA benefits, and is just here because it was the closest hospital, it was an emergency, whatever the reason was. Additionally, usually at the bottom, there may also be some information about next of kin and emergency contacts that are there as well. The next section over would show, right now it says visit not selected. It would show their current bed if the patient were hospitalized. And this next bar over would typically demonstrate their primary care physician at the top listed in the VA system, as well as the current resident and attending to which the patient is assigned. In the top right, we have some other buttons. This is the prescription drug monitoring program query, which links directly to the websites to log in. Flags that are on the patient's chart, JLV, which is remote VA information, remote data, which can pull in information from outside the VA system, any alarms or reminders, and then postings, which are also in this top right box. Then finally, we have usual computer application menu information, file, edit, view, tools, help, which we'll describe in more detail later. However, I'll point out the tools menu has a lot of helpful tools for our use when we're using CPRS.